Welcome to the What If It's Not Depression podcast. Your host, Dr. Achina Stein. And today we're going to be talking about nervous system repatterning. And it's another way of looking at brain retraining, and it's a little bit more holistic. And today we're going to be talking to Elisabeth Kristof. I'll tell you a little bit about her. Elisabeth Kristof is the founder of brainbased.com, an innovative online membership platform that helps people rewire their nervous systems, resolve trauma patterns, and build lasting resilience through daily neurosomatic training. At the core of Brain Based is her belief that everyone deserves access to the tools that work with, not against, their brain and body. Rooted in applied neurology and trauma-informed somatic practices, Brain-Based empowers individuals to move out of survival mode and into embodied sustainable change. That's so amazing. With over 15 years of experience in movement and brain-based therapies, Elisabeth is a leading expert in the field of trauma-informed applied neurology. She's also the founder of the NeurosomaticIntelligence NSI coaching certification and ICF accredited program that has trained hundreds of coaches, therapists, and practitioners in the science of nervous system regulation and neuroplasticity. Her work spans individual transformation and organizational change, bringing evidence-based tools into both personal and healing and professional leadership. She is the co-host of Trauma Rewired, a top 100 Apple podcast that explores the intersection of complex trauma, neuroplasticity, and somatic healing. Across all her work, she's deeply committed to making nervous system education accessible, actionable, and rooted in real-life transformation. And I'm so pleased to have you here, Elisabeth, because this is where the work really needs to happen. It needs to start here in order for people to heal chronic disease, mental and physical chronic disease. If your brain is on fire and feels threatened and in danger, you're not going to heal unless you address that. So I love to start with you talking about your what inspired you, how you got into this work, and I appreciate you being here.
Oh, thank you so much for having me. It really is an honor to be here, and I believe so much in the good work that you're doing and putting this information out for people. So really, thank you. It's an honor. Um, so how I got to where I'm at now in the world of applied neurology is, I'd always been really fascinated with the brain, the body, movement. I had a couple movement studios here in Austin, and we were working on developing our teacher training, and I knew brain science was the future of movement science. And so I started studying and getting certified in applied neurology and went down a long road of that education and just couldn't get enough of it.
Mm-hmm.
And then in 2018, I had one of those times where the floor really gets pulled out from underneath you. I was under a tremendous amount of stress. I lost my business at the time and my community, a tremendous amount of financial stress. At the same time, my partner at the time was diagnosed with a pretty rare cancer, and I went into being a full-time caretaker for him. And when I was going through all of this stress, I started experiencing really strong outputs of my own nervous system. My anxiety was really bad. I was in chronic pain. I was binge eating all of the time. That has been a lifelong thing for me. And I started trying to understand through him what had happened. Why was this healthy 40-year-old man? We didn't drink, we didn't smoke. Why did he get cancer? And he had complex trauma. And so I started reading all of the books like Waking the Tiger and The Body Keeps the Score and Complex Trauma. And I saw not only his story, but I saw myself in those books as well, and really began to connect the dots between early developmental experiences, nervous system dysregulation, and then the outcomes that we experience later in life. And I started taking a deep dive into the world of somatics for my own healing and realized as I was doing that that there was a huge gap in that space where applied neurology could be really powerful. I had all of this education about the brain and the nervous system, practical tools, a framework. And at the root of all of these things was the nervous system, was the brain and the nervous system. And so I began not only applying all of this to myself to change my own outputs and to then serve more people, my clients,
Right.
but I started really developing a framework for how do we integrate applied neurology into the world of somatics to help people have a different way to bring about some change in their brain and body. And that's when Neurosomatics was born. We
Mhm.
launched in 2020, and the growth has just been very organic, but very rapid because I think it's something that people were hungry for in the
Right.
world.
Absolutely. That's awesome. I'm so excited for you. You mentioned that you first started a movement studio. I'm not sure people will understand that term. Can you talk more about that?
Yeah, it
Mhm.
was Pilates, athletic training,
Okay.
physical therapy, rehabilitation. So I was really using applied neurology at that time for chronic pain reduction
Hmm.
and athletic performance. And that's really the sphere that applied neurology had lived in for the past 20 years.
Hmm.
It was a very cutting edge, practical way to work with people's bodies and nervous systems for athletic performance and pain.
Hmm.
But then there was this whole missing piece of what if we could use these same tools and principles for behavior change, for repatterning stress response, for creating new states of being inside of the body, because it's all coming from the root system, which is the nervous system. So, in the world of applied neuro and neurosomatics, we really break the nervous system down pretty simply, as a little oversimplified example, but your nervous system is always taking in information about the world around you through your extraceptive senses, like your eyes, your balance system, and your inner ear, your body mapping system, and then a really important system inside of you, your interoceptive system. You can think of that as like internal perception. And it's the
Hmm.
system that tells your brain what's going on inside of your body with your organs, with your breathing, with the emotional states that you're feeling. And so all of the time, our brain is gathering all these inputs from our different sensory input systems. And then it integrates that information and then it makes a decision. And a really important thing to think about that decision is the brain is constantly asking safe or unsafe. And
Mm.
then based on that answer, our brain generates an output. So we think of like everything in the that you experience as an output, not just your movement or your autonomic states like your breathing and your heart rate, but also your behaviors that are driven by that state, your emotional states, the cognitive thoughts that follow that state. All of these are outputs of the nervous system coming from the inputs and the interpretation. So when we try to make change, we're not trying to make change in the outputs by cognitively pushing our way through to that change. We're going back to the beginning of the loop. Can we start to make change in the inputs? And then can we start to make change in the way our brain interprets those inputs to change the output rather than just focusing on the output? So our nervous system takes in information about the world around us and inside of us, integrates it into our brain, and then generates an output. And all of our life experience comes from those outputs.
Right, right. And I love that you added that rather than cognitively trying to change those outputs, which is a lot of work, you're kind of fighting upstream. It's really
Mhm.
important to just start from the basics and look at, the inputs and the outputs to the body because the body senses a lot more than we realize. And our mind is kind of designed to ignore that because if you paid attention to all of it, you wouldn't be able to function. So it
That's right.
decides what to give you that's most important. And but there are people who are getting all sorts of inputs sent to their brain, and it's like, oh, the lights and the this and that. Like they're just so overwhelmed by it that's probably a problem in this system, right?
That's right. We have all of these stressors that we don't necessarily know about, right? We talk about them as seen and unseen stressors or known and unknown stressors. So you have the stress that you know about, relational stress, financial stress, the stress of systemic oppression and cultural big collective stressors that are happening, social media, work. But
Right.
there's also all of these unseen stressors, little deficits in your eyes or in the balance system in your inner ear or something with your respiration, or you're not getting good, clear signals from your interoceptive system. And all of these unknown, unseen stressors are driving up the stress load in the nervous system all of the time. And if you think of your nervous system uh, like a bucket, all of that stress is pouring into the bucket all of the time. And when that water level gets too high, our systems are intelligent. They understand too much stress for too long is dangerous. It causes disease. It leads to poor health outcomes. And the system is going to try to find a way to get you to reduce the water coming into the bucket. And that's when it will start to generate protective outputs like pain. It gets you to engage with the world less, take smaller steps, maybe not go work out, maybe a migraine, you go lay down in bed, pull the covers over your head. Maybe it's dissociation or an F response. Whatever it is in that moment, that is safer for your survival mind because it's reducing the inputs coming into the bucket so that the bucket doesn't overflow. So, if we can start to reduce these unseen stressors by helping to rehabilitate the nervous system, then the water level is going down all of the time on a second by second basis. And then you have more capacity to handle the other stress of life without moving into those same protective outputs.
Right, right, absolutely. And it's significantly worse, I think, when it starts in early childhood, especially with childhood trauma. So it's important to acknowledge that even though you might have felt well as a child, maybe you didn't have any issues, but it all adds up in that
Hmm.
bucket that you're talking about. And so you can have these issues later in life, but it starts very early. And you have
That's
to
right.
acknowledge those parts of you that are coming to the surface, so to speak, when that bucket does start overflowing.
Yes, absolutely. A lot of times these things don't manifest in our experience until later in life, but
Mhm.
really our developmental environment, it's like the water that we're swimming in, and our nervous system is constantly adapting to that water. And so it's really how we're patterned and shaped to then move through the world in adulthood. And so we develop all of these protective responses, protective interpretations of that sensory data. Our nervous system can become really hypervigilant to people's facial expressions, vocal tones, the light in the room. And all of that stress is compounding. And over time, that does lead to a high level of water in the bucket
Right.
because of all of that stress that has compounded over time. And when we talk about complex or developmental trauma, we like to say it's not, we don't call it disordered on the podcast. We actually say your nervous system is doing its job. It's doing the best that it can to protect you based on your past experience. And in order to create change, you just have to know how to work with the system to repattern it because it really is a divinely intelligent system that always has your protection and survival at the forefront.
Right. I totally agree. Yeah, we have a tendency in the conventional world to look at symptoms as disease or disorder as opposed to no, this is your body trying to fix something. Cholesterol is a perfect example. High cholesterol. Cholesterol goes up in times of stress in order to, it's almost like the engines, the lights on the engines of the police and the ambulance cars or the fire trucks, right? If they're going to the scene of the accident and trying to save you. So
That's right.
yeah, so when you see cholesterol going up for us, that's a clue that there's some inflammation in the body and your body's trying to repair something. So you wouldn't think that fire trucks and police or ambulances were the enemy, right? Right.
That's right.
The house is on fire and people are dying, you're going to see them at the scene of to try to rescue people. So in the same way, our body is doing the same thing. It's giving us signals. I mean, at least in our practice, and I don't know if you use the same terminologies, that we have a dashboard of lights, just like your car has a dashboard of telling you when the battery's out or running out, or there's an engine problem or you're running out of gas. It's you have to pay attention to that, or otherwise, if you ignore that, you're going to ultimately not be able to drive that car. And it's the same thing with the body. People have a tendency to ignore signals for whatever reason. And it's important to sort of retrain your brain to start listening and paying attention
Mhm.
to signals, which I'm sure you're going to talk about,
Yeah.
and really to start paying attention and shifting to making changes in the way you see things and respond to things. So this pattern of trauma, I think, is really important to look at, and that a lot of times it is based in the past. And from a psychiatric standpoint, at least I'm a therapist, so I know that we look for repeated traumas, repeated patterns in thinking, repeated patterns of how you respond to things. And those are all clues to try to understand, well, what happened and why are you responding this way? And is it really serving you now?
First of all, I love the analogy of the fire and the ambulance. And it's like we want to understand what's causing the fire, right?
Right.
What we want to actually start to put out the fire, not just send the ambulance away, right? And so we always want to be looking at the outputs as signals. If I want to change the output, what can I do at that root cause level to start to change the inputs so that that is not the same frequently occurring pattern in the nervous system? And then from a neurosomatic perspective, we really look at trauma as a present day occurrence, right? It's not just the event that happened in the past, it's the pattern that has been adaptively created in the nervous system to respond to the world, either the internal world or the external world. And then that pattern is constantly playing, producing those outputs, the stress level, the hypervigilance, the thoughts that come with that state, the emotional responses, the hormonal changes. Those are all a result of that frequently occurring pattern that becomes the well-worn pathway, because the more we do something, the better we get at it, right? Becomes the well-worn path of our brain and nervous system that it can rely on to protect us. And so trauma is not the event itself, but the pattern that has been created in the body and the nervous system. And if we want to start to understand how to address that pattern, we can follow the outputs back. Like, what is my body and my nervous system telling me? Because it's speaking to me through these outputs. When we start to learn the language of the nervous system, we know how to communicate with it. We know how to listen to those outputs as signals, and we also know how to speak to it through new inputs, right? And so we're really learning to speak the language of our own operating system.
Right, right. Yeah, it is like you said, it's an operating system that's just trying to do its job. Yeah.
Yeah,
Yeah,
yeah.
Gabor Mate actually says that it's not the event of the trauma, it's how your body has responded to the event and why it needed to respond in that way. Because people respond to the same event in so many different ways, and it's important to understand why you responded in a certain way, and that you might be responding still to similar inputs. It feels familiar, but it's not the same. And this is what we do in psychotherapy on a cognitive level, trying to figure that out. And I just want the listeners to know that there's some people who come to see us that they still feel horrible because well, I've been in therapy for years, and I know exactly why I do what I do and what happened, and we talk about it over and over and over again, but I don't get any better. This is the perfect person that needs to do brain-based therapy, brain retraining, nervous system retraining. That you're in the perfect place to do that. Yeah, yeah.
Yeah, that's really why this work exists, because I think the cognitive work is so important, right? It is really valuable to have an understanding of ourselves, why we do the things we do, have cognitive models to try to create change for ourselves. And sometimes we run into a wall with that where we know all of the things and we can't shift the behavior, the thoughts, the output. And that was my experience for a long time. I've done tons of personal development and been in therapy. I got sober at the age of 24, so I'd been on my healing path for a long time. And there were certain things I could not get out of. I couldn't get out of the anxiety. I couldn't get out of the binge eating. I couldn't get out of cycles of like workaholism and exertion and exhaustion and then crashing. And cognitively, I knew better. I had spiritual practices, all of that. But these internal states in my body were driving those behaviors. And until I really started to repattern, I couldn't implement the changes that I wanted to make in the same way that really gave me the freedom that I was looking for.
Yeah. It can also show up as avoiding things.
Hmm.
If you want to be in a certain place in your life and like, why do I keep avoiding these things? It's a similar thing, it's a similar reason, as opposed to powering through, like how you talked about some people power through past, use all this cognitive pushing themselves to do things, even though their body's like, no, it's just
Yes.
but then there's this avoidant behavior or shutting down of sorts that can show up in that way too. So it's this work is still important for that because that's a different kind of response.
Yeah, we tend to think of avoidance as another protective output, right?
Right.
When something is causing too much stress to my system, or there's a subconscious level, I'm not cognitively aware of it, but something about it, the answer to that question, safe or unsafe, is unsafe. And so I will, at a subconscious level, find ways to avoid the actions that I want to take because there is something that is creating too much stress in that for my system, or maybe my capacity. I just don't have the capacity, right? My bucket is already about to overflow, and my system is like, no more, no more. This is too much change, too much vulnerability, too much risk. Don't do the thing. And so I might find that I'm really tired, or I get brain fog or fatigue or shut down, or maybe I'm just immobilized in those moments. I'm meaning to have the conversation and I lose my voice. No words come out. I can't stay present in my body. And then afterwards, it's like, why couldn't I do that? And it's because I was a little bit frozen or flopped, or
Right.
my system was just shutting down.
Right, right. And by the way, everyone, this can show up if you're going to conventional doctors. You might have a new diagnosis of ADD, major depression, generalized anxiety disorder. It could even show up as panic. And so the diagnoses are descriptions of symptom patterns. It doesn't tell you why. It doesn't tell you why you have this pattern at all. It's really meant to match a pill to that diagnosis, to give you a billing slip and for research, but it never explains why. And so this is one of the whys that we're discussing, which is,
Mhm.
when in depression, you're like, what if it's not ADD? What if it's not depression? What if it's not anxiety or panic attacks? So it's really looking at these root causes, and this is one of the root causes that is honestly quite overlooked. So if you're in a place where you're not getting well, you're doing all the things, right? You're exercising, maybe exercising too hard because you're powering through, right? Exercising or moving your body. Some people don't like the word exercise. You're eating right, you're sleeping well, you're doing all the things, but you're still not feeling good and you're go, 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 go. Sometimes you have to like we're talking about, you got to listen to your body and make these changes.
Simple things to start out with, right? What we do on Brain Based is really teach a system and a framework of tools for repatterning. But you don't even like, if you want to start there, great. We do have a 2 free week trial that'll take you through and teach you a bunch of tools. But even in the beginning, simple things like processing a little bit of stress after an event through movement or sound, like giving yourself a few minutes after something that is stressful for you, even if you don't think it's stressful, but like I'm doing a podcast right now. After this, I'm going to have a few minutes where I shake my body, I make some sound, I help my body to complete that stress cycle after a meeting, after a client, baking in these little bit of times to mobilize our body and complete that stress response so that it's not building up all of the time. And then simple things too, like allowing your eyes to have a little bit of a break during the day. Our visual system is really important to our brain's understanding of what's going on in the world. It's at the top of the neural hierarchy. And when it gets tired, we get tired. And so if we want to resource ourselves, we're looking at screens all day, we're looking at objects that are close to our face, we have bright lights. Taking a moment or two between meetings, between sessions to either cover your eyes with a blindfold and take some long exhales for really just like 1 minute to give your visual system a break in between things, or going outside and looking at something in the distance, shifting your gaze from near to far. Take a couple breaths, breathing in through the nose, purse your lips, breathe out through your mouth, creating a little resistance for your exhale, and just help your system to start to learn this skill of modulation through the
Mhm.
day, like so that we're not staying stuck in these elevated states, but just simple things to help your system not always stay activated, which will start to give you a lot more capacity. Living in this world, going through things, even if we don't have complex trauma, even if you don't resonate with having any kind of trauma, although, let's be real, we're all living in the world. There's stressful things about our society, and our world is not really set up to be conducive to nervous system health with screens, with cars, with the lack of movement and social engagement. And so we have all of these things happening all the time that are activating our nervous system, putting us into more of a sympathetic state, that state of your nervous system that's preparing you for action. And it's fine to have a little bit of stress. We need stress for adaptation. We want to sometimes be in a little bit more sympathetic state, but we also need to have the ability to come down out of that state into more of a parasympathetic rest and digest state so that we can recover and adapt to that stress. And that's really what a healthy nervous system does, is be able to modulate between those states. That's really what we mean when we talk about nervous system regulation. And so when we're in those states, there's a physiological need for our body to have some either movement, sound, or using our breath. Those are the most simple ways to go about that, so that we give our body the signals, hey, the activity is over. I prepared for this. Like, if you were thinking about it as if you're being chased by a tiger, your system is getting activated, it's preparing for you to run. Well, the meeting might have the same effect inside, or the difficult conversation. And so we want to let our body know, hey, I've done this, I've taken the action. And so if I can give myself some impact to my bones by like tapping on the ribs or the thighs, those signals come from my body to my brain. Hey, this has happened. We can start to modulate through this. If I make some sound, if I start to slow my breath down at a physiological level, that's starting to help our system modulate through that experience.
Right, right. I love that the way you explain that, because you're right. I think you do have to take the time to let the body know the stress is over, because
Yes,
sometimes people leave a situation and it just continues in their
that's
brain
right.
on and on and on. And it could be even for days, right?
Yes,
And so
yes.
it's really important to catch yourself in that state and say, stop. I'm not in danger. It's over. It's over. So
Hmm.
I think there's a point where you have to process those emotions. There is a processing of emotions, but up to a point, right?
I'm a huge believer in emotional processing. I think emotions, like stress,
Hmm.
in the same way that stress is, are physiological events in the body, right? They're not just a cognitive experience. There's a whole cascade of chemical messengers and hormonal changes and muscle contractions and all of these things that happen with our emotions. And I really believe as human beings, we are meant to experience many emotions many times throughout the day. Um, but we have a resistance to feeling and processing those emotions. And that can really keep us stuck in certain states because, again, we're not kind of completing the cycle. And so we find ourselves in that rumination that you were talking about. We leave the event, but we're still held there because the emotion hasn't been processed. And so a lot of the work that I do is working with the body and the nervous system to be able to gently start to mobilize through breath and sound and movement those emotional experiences, because so many people too, especially if you have a history of complex trauma, emotions are not necessarily safe, especially to express. Many people have dissociation or repression as a well-worn pathway. So we start to feel those signals from inside of our body, and reflexively, before we can even think about it, we repress the emotion or we dissociate from those internal signals a little bit. And so, how can I start to work with the nervous system to repattern that so that I can hear my interoceptive signals with clarity and also with accuracy, right? Interpreting the right amount of threat to those signals so that I'm not always having the same response. And then little by little, in a minimum effective dose, starting to work with that so that I become competent at the skill of emotional regulation. We really think of everything as a skill, and every skill is trainable. You just have to know how to work with the body for that. And then you start to experience shifts, and you also feel more alive. I feel more, not just the big stuff that is hard, but also the joy and the connection and the presence in our own body as we start to work with that embodied piece of emotional expression.
Yes. Perfect explanation. It's all connected, right? And I like
It
the way,
is.
so it's very holistic.
So neurosomatic intelligence is really it's a very holistic way of
Mhm.
approaching nervous system rewiring or repatterning. So rather than just, in a moment of dysregulation, trying to do a couple breathing exercises or blanket tools that are prescribed out, we're really looking at all of the different sensory input systems, the eyes, the balance system in the inner ear, the body mapping system, and the interoceptive system. How are these functioning? Where are the deficits? Where are they adding stress to somebody's life on a second by second basis? And gradually rehabilitating all of these different systems with short, practical tools that people can implement throughout the day to begin. It's really a daily nervous system hygiene practice, just like you would think about brushing your teeth or taking a shower or going to the gym. It's this very practical way to work with your nervous system, all components of it, vagus nerve health, cranial nerve health, gently throughout the day,
Mhm.
and let those changes compound. It's like physical therapy for
Mhm.
your nervous system.
Mhm.
And so it's more holistic. And I would also say we're very, very big on this idea that everybody's nervous system is unique. N equals one when we are talking
Right.
about nervous system health. And so rather than putting out like these are the tools that work in a moment of dysregulation, it's about teaching you to be the expert of your own nervous system and assessing and reassessing what works for you, and then finding the different inputs, the different sensory tools that work really well for you to use throughout the day, because everybody's going to have different responses. So we see a lot of like things on Instagram or social media, do this, do that, do that. And I think that is great. And I'm glad that all that information is getting out there. But I also really want people to understand how to know if something is right for their nervous system so that they're actually moving in the direction that they want to with their nervous system work.
Right. Yeah. And that's the key, knowing what's right for you. And the only way you're going to know is by working with someone who can evaluate, assess you for that and figure it out with you. So,
Yeah.
yeah, there's a lot of fun, interesting things on TikTok and Instagram and even Facebook, I guess, that gives people little tools to do, but they might try it and they might actually feel worse, so you
That's
have
right.
to be careful about what you're doing, and understand why and whether or not it's right for you. So I'm glad you explained that. So yeah,
Yeah.
this has been great. I'm really enjoying this conversation, and I'm glad that you're one more program, because I know that this is really important, and I want people to have options, There's other programs out there, and it's kind of like sort of shopping for the one that feels right to you. I always tell my patients that I have no judgment which one you choose. Just spend the time to figure it out. And, I'd love to give one more option for this kind of work that's really, really important, especially if you have or childhood trauma and you're very, very activated, stressed and not able to settle your nervous system down. You cannot do this by just willing it. You cannot will this to happen. So,
That's right.
really, really need to learn all of this. So, I know you mentioned it earlier that you have a two free weeks of neurosomatic training on brain based. And it's at rewiretrial.com. And people can find you at brainbase.com and neurosomatic.com. And on Facebook, it's at brainbased.wellness. And looks like also at NeurosomaticIntelligence. Lots of different places that people can find you.
Yeah, the best place to get started if you want to experience the tools is rewiretrial.com. And you can find me there. I'm on there live teaching multiple classes a week. We have a huge
Right.
on-demand library. It's the best entry point, and then you can find all the other things from there.
Awesome. Awesome. Well, thank you for sharing the 2 weeks with people. I think it's really good to have a taste of it.
Hmm.
It's like
So
a,
important. Yeah.
yeah, it
Does it
really,
resonate for you? How does your body respond? How do you respond to me? You know, it's all
right.
important because everybody is unique and different. And like you said, there's many different modalities of healing. You just need to look around and
Mhm.
find your spot.
Right. Absolutely. Well, is there anything else that you would like to add that maybe we didn't touch upon that you feel like it's so important for people to know right now?
I think closing thought would be that we are neuroplastic beings. We are changing and adapting all of the time, and that means we're never stuck. We're more than our patterns, we're more than those protective limitations. We just have to understand about our own operating system and how to work with it. And when we do, that gives us agency to create change in the direction that we want because we are always changing. So you're never stuck. Neuroplasticity is real, and you can have the tools to create that change in the way that you want.
Yeah, absolutely. Thank you so much for that. Well, it was a pleasure talking to you and getting to know you. Thank you for the work that you're doing for the world, and it's so so much needed. And I'm glad that it worked for you and others. You're helping so many people, and I look forward to listening to you on your podcast too.
Thank you so much. And thank you for having me. And again, thank you for this podcast and putting this good work out into the world.
Great. Thank you so much. All right. Take care. Have a great rest of your day.
You too. Thank you so much.